I want to come back to Yambio because really it's a very innovative, very interesting project. I mean, South Sudan is one of the countries with the lowest access to antiretroviral therapy, where HIV, AIDS, and TB are the second, third cause of mortality in the country. You can see the data of WHO. So I think this project of bringing the test and the antiretroviral therapy the closest as possible as home of patients is very interesting. The testing at home and the testing at community level has been tested in some of other countries, Zimbabwe, Kenya, South Africa, and in fact is recommended by WHO as a strategy to increase the HIV diagnosis inside the population. But taking the treatment, bringing the treatment to the nearest possible to the house of patient, not. And mainly because South Sudan is in an unstable context. I mean, this is a context where today you are quiet, but tomorrow maybe population has to flee. Locally, we aim to increase the HIV diagnosis, and we aim to increase the coverage, the access to antiretroviral therapy, so we can reduce the mortality by HIV/AIDS in the community, and also reduce the transmission, because nowadays we know that treating the people will reduce the transmission in the community. Well, first of all, we want to replicate the stakeholders can replicate in the rest of South Sudan. I mean, this is one of the countries with the lowest access to care all over the world. I mean, in general, in 2012, less than 10% of people who needed antiretroviral therapy had access to it. So HIV in that moment was the second cause of mortality in the country. So in fact, test and treat in the community can help to increase the access to diagnosis, increase the access to treatment, and reduce the mortality and the quantity of diseases that people are suffering due to AIDS, due to HIV.